couple of different areas, including all the different details of the genetic predispositions to progression, how they influence inflammatory processes, the remarkable differences from people with large amounts of amyloid and tau. Many of patients are resistant to degenerative cognition, and then some of the details on how amyloid itself is toxic to the hippocampal cells that cause decline in memory. I found all of these things incredibly helpful to me to fill in some of the details of what before I had a general feeling of amyloid is bad, amyloid's toxic, but unclear exactly how it impacted things. The idea that there are potential biomarkers that can be used in a widespread clinical setting to be able to screen patients, being able to differentiate who has underlying Alzheimer's pathology, who is likely to progress from preclinical mild cognitive impairment, early dementia stages. These biomarkers will be a total game changer to be able to see who might be appropriate for interventions. I just can't believe when I was a resident, doing brain cutting, the idea of where we were at then and now potentially being able to screen with a blood test that will be a close approximation of the underlying pathology is just astounding to me. I think my key takeaway is how amyloid and tau are toxic to the function of the cells, the influences of inflammatory cells, and the interaction with other non-neurons influencing the degeneration. I think it's incredibly exciting that we're on the edge of being able to offer patients in the clinic information that we haven't had without proceeding to invasive tests like spinal fluid testing or expensive tests like PET scans, at the cusp of being able to offer treatment that actually influences their progression cognitively. I think is a very exciting time to be practicing neurology.